This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
I want to talk about gender affirming GYN care. But wait, before you say anything, I just want to preface this with something, because when we added this to our website, I did get a tiny bit of backlash from patients.
Really?
Yes. And I can't remember because it was a while ago, but I do remember needing to make it sound that, I mean, obviously you're not operating on anybody. You're just helping.
Well, that's not entirely true.
Well, I mean, you're not changing a male to a woman surgically. You're not turning a penis
into a
vagina.
That's true.
I had to be clear about that.
Good.
Okay. So anyway, I just wanted to say that it was, I think, questionable with some patients that we were doing that in the office. So
yeah.
Anyway, we do have now quite a few patients.
Yes. So we deal and help patients in the office that are both male to female and female to male, and we do it in a number of ways. I don't do any radical gender-changing surgery. The only surgery that I do relative to this is a hysterectomy on a woman who wants to be male but doesn't want to have vaginal bleeding.
Yeah.
And complications there. So a hysterectomy for that reason, that's within my training.
Yeah.
That's a straightforward thing to do. And, but in terms of creation of vaginas, penile implants, I don't do those. What I do for those patients and how I care for them is hormonal.
Mm-hmm.
And so I'm looking at how we can help them into the gender choice that they're wanting.
And that's why they're calling. I just want to be clear about that.
Yes.
So their needs are strictly hormonal unless somebody wants a hysterectomy.
Right.
The reason why they're calling is hormonal.
Yes.
Yeah.
And the hormonal changes are fairly straightforward. I mean, we investigate somebody's general health, which is fairly comprehensive lab work, hormonal work, not just hormonal work, but what's the cardiovascular system looking like and what risk factors there, what's the glucose metabolism, all those types of things. And before we get into a plan of moving them hormonally into the direction that they want to be. So it is for the male to female, we want to diminish the effects of testosterone. And we want to, then we give them estrogen as well, and vice versa.
Yeah.
So these are things that can be easily done and safe procedures and effective.
Well, you know, it was first brought to my attention, and I don't know if you remember this, but somebody from the UCSB Health Center reached out to me or to the office, but I called them back because there weren't any providers in Santa Barbara offering transgender care.
Right.
And that's when we first took a look at it and decided to build some content on our website and put it on our website.
Yeah.
A lot of this, well, actually, more is covered by insurance for transgender than is covered for women.
That's true in some areas. Yeah.
So a lot of times the women that are transgender getting hysterectomies, that's covered by their insurance as long as they've checked all the boxes of things to do beforehand.
Yeah, right.
Which we have to get.
They have to see therapists.
Yeah.
Get at least 2 providers
Yeah.
to make that recommendation. And then usually it's covered by insurance.
Yeah.
Yeah.
So, in terms of the controversies, challenging, providers, what would you say, if any?
There really shouldn't be any controversies here. I mean, the controversies, I think, would be mainly based on religious beliefs and having to cross that bridge. So I may have patients who don't like the fact that I'm willing to help transgender patients.
Yeah.
And, well, I'm sorry. Too bad.
Yeah.
It's because I feel these patients they're really great patients.
They really are great patients.
And they're appreciative. They're compliant.
Mm-hmm.
And
there's definitely some of the easier patients we have in the office are the transgender patients.
Yes. Because not all of our patients are easy to deal with.
Well, I think it's really great. We offer this, and that care is ongoing, right? The transit's ongoing. We keep those patients a long time.
Yeah.
Great. Thank you.
Thank you.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.